Aisha and Nita. It's really powerful to hear that kind of perspective and focus. I think that really grounds a lot of the work that we do as health professionals who are committed to action on climate change. My name is Fulgencio-Turner. I'm the director of the Climate for Health program at EcoAmerica. And so I'll be summarizing quickly. I want to leave time for Q&A. What the research literature tells us about solutions, about what we can do to take action on the scope of this challenge, and how we can start to build more and more momentum to protect the mental health of youth and solve the climate crisis. And so I'll just note that the research on solutions is growing really rapidly. What we're offering is a starting point. There are a lot more ideas, or ideas growing every day. And for folks in this room, if you want to talk with us more about how to connect the dots, how to bring this to the health sector, how to bring the health perspective on climate action, the mental health focus forward, please do reach out to us. We'll definitely be in contact with all of you. So the most critical step that we must collectively take to protect and enhance young people's mental health in the face of a changing climate is to dramatically reduce our greenhouse gas emissions. We must address climate change at its root and reduce the scope of the challenge that is affecting us today and will grow in the future. And because our past emissions will continue to cause harm, will continue to increase climate impacts, there's no on-off switch for this. There will be more extreme weather, there will be greater heat. So we must also prepare our communities for future difficulties and build resilience in communities. And so as we've mentioned throughout this presentation, these impacts are not, they are disproportionately affecting people who are already face greater vulnerabilities, people of color, lower income communities, fence line, frontline communities. And so we must focus and center the voices of these and needs of these communities. These communities have really strong and powerful ideas for what everyone needs to be resilient. And so bringing them into the conversation and making sure that our solutions center their needs is a good way to make those solutions more effective and more lasting and more powerful. When it comes to infants, children, and youth, future health and well-being is critically dependent upon having their basic needs met during early development. So in order to protect youth's current and future mental health, we must make sure that everyone in the country has access to clean water, clean air, nutritious food, and a stable home, stable community, that these disruptions are limited and mitigated and controlled. And finally, we need system-wide attention to expanding and strengthening access to mental health care. At the community level, that there's a lot that individual communities can do to have an impact on climate change. And one of the first things is having a climate action plan. More and more local jurisdictions and communities are building out really strong plans for how to both accelerate a community's decarbonization, as while also increasing resilience and adaptation among the current risks facing that community. And so in order to put, one of the things that we found in our work is that by engaging young people in these plans, especially young people who are facing the highest risks, it not only, again, makes these plans stronger, it brings in the people who are at most risk, who has the clearest ideas about what they need, and giving them a seat at the table, giving them meaningful input, but it also helps to improve those communities' mental health and well-being by giving them real empowerment, authentic seat at the table, really does address the existing mental health need, that you're not marginalized and off to the side on this issue, but by having real power brings real relief to some of these mental health crises. So young people also, and this can range, the kinds of things that they can do, could be joining a committee for planning around upcoming disasters, having tree planting to mitigate urban heat islands and limited access to green spaces, and then also collective actions like attending a climate march. All of these things buffer and protect youth mental health. And so throughout all of this, we know that including children and centering their work, centering the opportunities for collective action is a way to really strengthen the work and to improve their mental health. School-based caretakers, educators can do a great deal to help bring these kinds of solutions to young people and also empower them to take more action. So this could start off with some of the basics of resilience and adaptation at these facilities. Do these buildings have good air quality? Is there proper filtration of the air? Is there proper cooling during the hotter months? Does the building reflect sound climate and energy principles to reduce wasteful emissions? These are all things that have an immediate impact on the well-being of young people And by bringing young people into the decision making and action plans can be an immediate mental health intervention for these young people as well. So also, in addition to that physical environment, there's the social environment. So making sure that teachers and staff are able to provide support to their students and able to have these conversations about their anxieties and encourage caring social support networks. One of the things that also can strengthen the work that these facilities do is making sure that the educational resources and curricula do acknowledge climate change, the threats to health, and what the solutions are and how young people can get engaged in that and how they can begin to take action. Again, making this something where people are able to take action, are empowered, not something that is happening to you, that is out of your control, but something that you have control of and can take action. Schools can do an incredible amount of breaking through those barriers and helping people to understand those opportunities. And then I speak most days with health professionals about how they can engage with families, with other health professionals, whether they're clinicians or public health workers, on climate action and why taking action on climate change is a public health priority. In the mental health spectrum, we know that climate distress and eco-anxiety is a relatively new phenomenon for most people to be identifying at the very least, even if this existed before. And so that also means that there are incredible opportunities for healthcare professionals to adapt to this new environment and to shift as we recognize this new environment and both provide needed resources to individual patients and address some of the systemic issues in our healthcare system that limit access to mental health services that are needed and social supports that can help to build that resilience so that people are able to sustain these impacts better. In addition, healthcare professionals can also work to develop tools and assessments for early detection and for problems related to climate change. So that could be climate anxiety or post-traumatic stress disorder, making sure that health professionals across the board are aware of that these things are rising in prevalence and have the tools to screen and refer to additional resources is critical to making sure that the problems don't grow in those individual children. And then finally, we want to make sure that health professionals are empowered to take action that might be at a lower intensity and less formal level. Again, having these conversations with patients, with families about climate change, about its reality, ignoring this and hiding away from it does not solve it. It makes these things worse. It makes especially the mental health impacts, because people know it's there. It can't be hidden from at this point, and it will aggravate the mental health impacts to pretend like it doesn't. And then finally, we do want to make sure that healthcare professionals are engaged on research and development of new treatments and interventions to these tools. That there is a great deal of opportunity to make sure that as these problems grow, that our solutions grow as well, and that we come up with new ways to support young people and other communities. Parents and caregivers are just an immediate and critical source of support for children in any stressful event. And so one of the things that Megan mentioned earlier is that making sure that the family is stable and supported is a key way to make sure that children are stable and supported. And so in order to protect children's mental health, we do need to make sure that those family units have the resources that they need and have support and stability. So making sure that these communities, especially during disasters and other disruptive events, have the resources they need is a mental health solution and is a climate action. And so we want to make sure that that is ingrained in all of our work and has that equity and justice focus. So depending on their age, children benefit from different kinds of support. So younger children might need guidance and reassurance and stability. Older people might need someone to talk to who takes their concerns seriously and engages in a conversation about action. And children, but we know that children whose parents and caregivers speak with them more about this in a solution-oriented way are more likely to adopt healthy coping approaches. And so this is connected to better mental health long-term. And so again, having these conversations as a family and being upfront about it and engaging honestly in a solutions-oriented way, not in a distress-oriented way, is a great way that family members can, again, not hide from this issue, but engage with folks and to bring it forward. So I think that all of these resources, all of these different strategies are outlined in a lot more detail in the report